Why is belly fat a major stroke risk? Belly fat, often called abdominal or central obesity, is a significant risk factor for stroke. This is because it is closely linked to various cardiovascular issues that can lead to strokes, particularly ischemic strokes. Unlike general obesity, which is often measured by body mass index, belly fat is a more accurate predictor of stroke risk. This fat accumulation is usually assessed by waist-to-hip ratio or waist circumference, making it a crucial factor in understanding stroke risk across different populations. One of the main reasons belly fat increases stroke risk is its association with atherosclerosis and vascular disease. Abdominal fat is not just a passive storage of energy, it is metabolically active. It can promote the buildup of plaques in arteries, which can block blood flow to the brain and result in an ischemic stroke. Research shows that there is a strong correlation between abdominal obesity and markers of vascular disease, indicating that belly fat poses a greater risk than body mass index alone. Additionally, excess belly fat is linked to several metabolic and inflammatory conditions. These include insulin resistance, high blood pressure, unhealthy cholesterol levels, and chronic low-grade inflammation. All of these factors can damage blood vessels and increase the likelihood of clot formation or vessel rupture, both of which are leading causes of stroke. Interestingly, studies indicate that waist-to-hip ratio and waist circumference are more reliable indicators of stroke risk than body mass index. This is because body mass index does not account for fat distribution or muscle mass. For instance, someone may have a normal body mass index but still have a high amount of abdominal fat, putting them at a greater risk for stroke. Belly fat's impact on stroke risk is particularly pronounced in younger individuals and across various ethnicities. Research has shown that abdominal obesity can significantly affect stroke risk in younger populations, making it an independent risk factor regardless of race or ethnicity. When it comes to specific types of strokes, central obesity is particularly associated with ischemic stroke risk. Some studies even suggest a link between abdominal fat and intracerebral hemorrhage, although these relationships can vary depending on the type of stroke. For stroke prevention, it is essential to focus on reducing belly fat through lifestyle changes. This can include adopting a healthier diet, increasing physical activity, and managing weight. Instead of relying solely on body mass index as a risk indicator, measuring waist circumference or waist-to-hip ratio can provide a clearer picture of an individual's stroke risk. In summary, belly fat is a major stroke risk factor because it directly contributes to vascular damage and conditions that lead to strokes more significantly than overall body weight. Addressing abdominal obesity is vital for effective stroke prevention and risk management strategies. Always consult healthcare professionals for personalized advice and guidance on managing stroke risk.